Amanda here with StraightSmile Solutions, and today we're going to be talking a little bit more about IPR or interproximal reduction. This is just going to be a really quick high-level video to take you through IPR and what the options are. I have a really detailed video that you can go to that's almost an hour long. It's from a webinar that I did, and it is available at my webpage gpwebinar.com. Again, that's GP, letter G, letter P, webinar.com. So make sure you go there to watch the full course. But I'll just take you through high level real quick, a little bit about IPR for aligners, for braces, and how you can do it accurately. And if you do it accurately, your cases will turn out better. So there's a lot of pain points, and there's a lot of reason that dentists struggle with IPR. Part of it is the timing or the staging, picking the right teeth to do it on. What should they use? Discs, strips, files, learning how to read the IPR map. There's quite a lot. So we can go through more in that in the actual full video. So basically, in a nutshell, what's the benefits of IPR? So, well, you might have a Bolton discrepancy, which is where the lateral incisors are smaller than they should be. So you might add some lower IPR to help balance out the bite and get ideal overjet. It might be related to tooth shape or having black triangles, and you want to eliminate those kind of unsightly black triangles. Sometimes those can't be predicted, so it's great to factor it in, maybe to get your midlines on without elastics, to help with creating space, an alternative to taking out teeth, right? More stability if you have broader contacts. It means less relapse. Helps with just unfortunate asymmetries and just a healthy way to create space in periodontal patients. If you have crowding and you have periodontally compromised teeth, sometimes it's not the best thing to push them forward and out, because that can actually loosen them more and cause more tissue breakdown. But interproximal reduction is actually a great way to help to stabilize them. So I do recommend IPR and having a really good plan for IPR in your patients. Okay. So in the video that we're going to be recommending that you go to, which is at gpwebinar.com, we are going to be going over the Garrison Fit Strip system. This is the system that's available in the United States. It's a great system. It's probably my favorite. There are other ones like Contact EZ. There's ones that are on rotary, slow speeds, high speeds. I really try to recommend staying away from anything that's mechanical in nature, because unless you have like a huge, really long tooth and a gigantic embrasure, the risk of ledging those teeth is high, and it can be very uncomfortable and scary for the patient as well. So I really like this system because you can pre-curve it and put it on the stick. You can pre-curve it and do it when the teeth are crooked. You can use it as straight, and you don't have to pinch it to pre-curve it. And this will make more sense when you watch the video. So you can use it at the beginning of treatment when teeth are still crooked. You can use it at the end of treatment. There's just a lot of different options. Price point is a little bit more than $200, I think. And feel free to buzz me if you'd like a referral. I think they might give you guys a discount if I refer you. But it's a pretty all-inclusive system. Another thing to really keep in mind is the IPR gauges. You need to have an accurate gauge, because if you don't, your IPR is not going to be accurate, right? So, and you shouldn't be shoving them in when you're gauging. It should just gently slide in. So make sure you have an IPR gauge as well. Okay. Things that you need to have the kit. I would definitely have some floss, check contacts. I like to do fluoride afterwards, but I like to ask the patients first. The IPR gauge. The prescription chart. I mean, sometimes if you're doing braces, maybe it doesn't say exactly where to do it. Maybe you're just going by, I've got overjet and I've got class 1 canine, so okay, I guess I need to do some IPR, or the other way around. But if you're doing Invisalign, ClearCorrect, 6-month smiles, or a variety of different full contour, global orthodontic solutions, they're all going to tell you exactly when to do it, where to stage it, and how much to do. So it's pretty easy. Make sure you isolate well, get your tissue out of the way, right? I always recommend tying some floss on the IPR strip so it does drop it down their mouth. Check with your floss to make sure your contacts are fully broken. I like to start with a serrated saw first. There's just quite a lot that you can do, and here's some demos here. I'm doing it on a type it on here, but you kind of open the contact, and then you kind of work your way up the files, and then you way back down as you finish and polish. You can also use just regular composite finishing strips to help finish and make sure it's really nice and smooth and get around the contacts. And this is what that kit looks like. So be sure you do visit gpwebinar.com to watch this full course that we put on. So it's an encore presentation. All right, anyways, that's pretty much it. Any other questions, do submit your questions to StraightSmileSolutions.com. We'll be glad to make a video for you to help meet your needs. All right, thank you so much and have a great day.